Now, some scientists are worried about the possible spike in COVID-19 infection rate now that the country has entered level 4 of the national lockdown. The movement of people visibly increased from the 1st of May, which was on Friday, when the eased regulations came into effect. About 1.5 million people are expected to return to work this week as government attempts to open up some parts of the economy. And to discuss this further, we're joined by Director and Virologist at the KwaZulu-Natal Research, Innovation and Sequencing Platform at UKZN, Professor Tulio de Oliveira. Good morning and thanks for your time this morning, Professor.
Good morning, Sakina, and good morning to your listeners.
So we pulsed viewers of Morning Live for their response. But what was your immediate reaction on the 1st of May when we saw people flooding to malls and other public spaces to take in a bit of exercise, such as jogging, and that happening across the country, of course?
Yeah, I think that's a normal reaction. Yeah, people needed to get back into their normal lives. Yeah. Unfortunately, we will have to adapt.
Once again, to our
find
viewers,
ways to live with this virus.
Apologies there. We are seemingly getting some feedback on the sound there to Professor de Oliveira as we try to talk about easing of level 4 legislation, or should I say regulations, here in South Africa and what it has meant. Let's try again, Professor de Oliveira. So social distancing, for example, was seemingly ignored in some instances, as we saw in videos on social media, even in our own coverage. What is this indicative of?
I think that is indicative that people have just to come back to the normal life. Yeah. And we have to adapt it to live with this virus. And that's where the scientists, the government, the media, and the NGOs have an important role to play, because I also saw in your media that on the 2nd and the 3rd of May was much less movements, both on the beachfront, but also in the shoppings.
So a question that many people have been grappling with, Professor de Oliveira, is, of course, we're seeing the easing of lockdowns regulations when we are seeing an increase in the number of positive test cases in the country. So people are questioning, why then did we go on lockdown when we had fewer positive cases and we're opening up the space and allowing people to go out and go to work when there are more positive cases being seen?
I think that's also important that we get to our normal life. Yeah, I think that we cannot just hide for 18 months until expect a vaccine or the virus stop transmitting. Yeah, we're gonna have to learn to live with this virus. We're gonna have to learn to practice social distance, yeah, to wash more our hands, to sanitize the environment, yeah. So I think that if you saw some of our statistics, when this epidemic started, we were in the same trajectory as the UK. The numbers didn't seem to be very high, but the doubling time of the virus was every 2 or 3 days, we would double the number of infection. And by doing the lockdown, we decreased this doubling time of infection from 2 to 3 days to 2 weeks. Yeah. So despite we seeing higher numbers, yeah, they are much less than what we expected. If we haven't done the lockdown before, we would have around 100,000 infections now and close to 25,000 deaths if we are following the exactly same trajectory of the UK. So I think that the lockdown really decreased the level of the virus. Yeah, it also allowed our hospital and our facilities to get prepared. And now we have to start easing the lockdown to allow people to come back to the normal life. Yeah, but we have to also keep a very strong eye on the infectious rates to see if we're going to need more extreme kind of intervention, such as further lockdowns. And that's why it's really important that people take serious this virus and that really practice both social distance, wear a mask, wash their hands, and also sanitize, especially a surface that infected people can get in contact with.
What are the expectations, though, in terms of the virus spreading at this point, where people are being allowed, at least eased back into the workspace and elsewhere? Are we expecting those numbers to increase, and if so, exponentially or otherwise?
So we are expecting. And some of our results that was widely publicized show that we are expecting the virus to increase between 5%, that's the daily increase of new case, to around 10%. And if you see yesterday, we had 447 new infections, which if you divide it by the number of the total infections that were around 6,200, you're going to get an increased rate on yesterday on the total number of cases of 7%. So we expect the virus to keep in this trajectory. It's quite important to note that they increase the previous day. We also expect to see outburst of outbreaks and localized outbreaks. And you probably saw in the media, we had some outbreaks in private and government hospitals. We had some localized outbreaks in pharmacies, in prisons. We had localized outbreaks also in bakeries and even that produce medicine. So that's going to be normal. And we can also expect to see outbreaks in schools and work environment as people return. So what we have to do is not to get completely worked out and completely freak out about that outbreaks, but is to really expect them, and try to act quick in way that we can stop the spread of that localized outbreaks and getting lessons that can avoid outbreaks in similar areas.
Professor de Oliveira, and of course concern about those localized outbreaks, because a survey by the Human Sciences Research Council shows that people are actually aware of the virus. However, many individuals illustrating that, they are not too fazed by it and therefore go about their day-to-day business as they would. So in terms of government's preparedness and ability to respond to these outbreaks, are you satisfied with what is in place so far?
Yes, of course, I am satisfied. We avoid a generalized epidemic in South Africa, and that's really important. You just have to see in the news what is happening in the UK, what's happening in Italy, what's happening in Spain, what's happening now in Brazil. So I think that the response, just to avoid this generalized outbreak and to have currently our hospitals empty, was a massive good response. It's much easier now to focus on localized outbreaks than try to control a generalized outbreaks. Another thing that the public may not be aware, but South Africa is one of the only countries in the world that the absolute number of deaths has decreased since the beginning of this COVID-19 pandemic. And that also was a side effect of the lockdown and the stop selling of alcohol. We saw a massive decrease of non-natural deaths in South Africa. This is murders, car accidents, accidents, and that's really highlighted by fantastic work by the South African Medical Research Council. So we're gonna have to work hard to control localized outbreaks, but we could be in a 10 times worse position as the country. And we have to get the country moving back. And what is very important is people to take this virus very serious, and try to really change behavior, because either that's gonna be done voluntary, what we are hoping now with the media, with the government, with scientists trying to highlight how the virus is transmitted, or maybe involuntary by going back to highest level of lockdowns. So it's up to the public, and as scientists and government and the media, we have an important role to try to help on that.
Just finally, Professor de Oliveira, what is your prediction regarding the coronavirus at this point? How high do you think our infection rate could go? And also, what could we be looking at a final possible death toll at the point where we completely open up?
Yes, so unfortunately, I cannot predict that, especially because the area of research that we work is analysis of data in real time. We are not modelers, and it's quite famous in this outbreak. A lot of modelers got the results wrong. What we know is that by comparing the trajectory of the virus with other countries that in the same trajectories, we know that we have avoided at least 90,000 infections at the moment. Yeah, so that we know by comparing real data, not modeling. Yeah, how big the outbreaks are gonna get, I don't know. But one thing that we know is that we're gonna continue analyzing this data in real time to try to really feed back to both public and private institutions to try to decrease the transmission of the virus.
Thanks so much for your time, Professor Tulio de Oliveira, Director and Virologist at the KwaZulu-Natal Research Innovation and Sequencing Platform at UKZN, talking to us about the possible repercussions of level 4 of the lockdown as people move around a bit more. Let's take a break.